Jane Pearson, and I'm a physician in the cardiology department, and I get to work in the wellness center helping people who've had heart disease figure out how not to have more. And most of my time is in the clinic figuring out numbers. I've got all sorts of great names by my partners, like the numbers geek and the food police and all sorts of other things, but that's kind of the basis of my talk today. And I'm hoping when you leave, everyone will learn at least one thing about how to recognize perhaps your risk for heart disease or not as we go through these things. But the first thing that I think is really important is just to help people understand when we talk about heart disease, really what do we mean, okay? So just a little basic anatomy, remembering that the heart is the size of a fist, it's in the chest, it's protected by your rib cage, and its job is literally to pump blood, oxygen, and nutrients to every square inch of your body. And so sometimes I like people to have the image that if we want to give your heart a vacation so that it will last a long time and be healthy, and one of the ways it can do that is if there's less work for it to do. And so we want to think of how we can make our heart muscle more efficient and help our whole bodies to be more efficient by requiring less of it. I think it's interesting, and most people do not realize that the arteries that we're talking about, which are the problem when people have heart attacks, are actually located on the outside of the heart. Okay, you can see those little squiggly lines labeled 1 through 5 are the coronary arteries. Okay, those are the blood vessels that actually feed oxygen to the heart muscle and keep it healthy. And if one of those arteries becomes blocked, that's what we call a heart attack. Okay, so there's a big disconnect that I have to help my patients understand every day, in that when we talk about heart disease, we're talking about blood vessels of the heart disease, okay? And so it's a really important concept. I think perhaps this picture might help everybody understand it a little bit better, because again, we're talking about heart disease, coronary artery disease, or diseases of the blood vessels that are affecting the heart. So this is a picture right here in the corner of what a normal artery on the inside looks like, okay? On the left, a normal artery, it's very shiny, it's smooth. You can just imagine that the blood just travels through there just without any problem at all. And everything is healthy. It can deliver a large amount of oxygen and blood to whatever muscle needs it. On the right, you can see that that's starting to fill in with some yellow gooey stuff that we call plaque, okay? And as plaque develops, it sort of encroaches how much blood can actually get through the blood vessel or the tube. And this is what we call coronary artery disease, okay? It's plaque in the blood vessel. The question is, why do you get plaque? Because really you don't want plaque, because plaque is the disease. And we're going to talk about how not to get plaque. This is another way of looking at the arteries, okay? This is, imagine an artery is a straw and it's cut on end and you're looking down the straw, okay? This is normal. This is a very healthy looking artery. The lining is, it kind of glistens a little bit, it's shiny, it's healthy, it's smooth. In people who are at risk of developing heart disease, even when they're teenagers or in their 20s, you can start to see what's called a fatty streak, which is just this little yellow line in the artery that's actually cholesterol that's already gotten into that artery wall. And as that process progresses through different things we're going to talk about, you can get this plaque that's developing. It kind of starts between the layers of the artery and takes up space in that artery. And then the worst outcome is when that plaque breaks open, it causes this huge chemical reaction and basically causes a lot of inflammatory markers in the body to try to heal it and fix it, and it makes a clot, and it clots the vessel, and that's called a heart attack, okay? So really when we talk about coronary artery disease, we need to talk about how to keep our arteries healthy, okay? So this is kind of where the fun starts. I promised on my talk I'd teach you things that could keep the arteries healthy, really. That's what heart disease is. So here's the list, and it looks like the same list that everybody has known forever and ever and ever. Eat right, have your blood pressure, have your cholesterol controlled, don't get diabetes, don't eat like the rest of the Americans eat, and all of that. But that's all kind of boring, and so I decided that we're going to kind of take pieces of these, and we're going to play a little Jeopardy. Since I'm the numbers geek, I decided, okay, I can ask you guys numbers questions. Everything we're going to talk about from here on out are about numbers, okay? And the deal is they're all going to pertain to things on this list, and I need you guys to help me figure out what the numbers mean. First one, answer is 6 miles. What is the question? Come on.
How many miles should you walk a week?
Ooh, that's a really good idea, but of course we would want 5 miles walked in a day. Wrong answer. Yes, another
How
answer.
fast do you have
have to walk fast enough to really get an aerobic benefit, and that's a really good idea. But in fact, 6 miles is the distance of arteries that each and every one of us has in our bodies. We have 6 miles of arteries going through our bodies. Okay, a couple of inches of those goes through the heart arteries. But we have arteries everywhere in our body, and to me that's super important to think about, because anytime you take care of the heart arteries, you take care of all of the other mileage of arteries that we also have in our bodies. 1 to 4. What could I be thinking about when I put up this number? 1 to 4. How could that pertain to heart disease? I'll give you clues if you don't think about it. Very good. Awesome. I wish I had a prize for you, because yes, smoking is the number one, to not smoke is the number one way to not have a heart attack. Even being exposed to secondhand smoke increases your risk. And people think that if they just socially smoke 1 to 4 cigarettes, they're okay. But in fact, that actually doubles your risk of heart disease. 1 to 4 cigarettes per day. Smoking more than that, of course, escalates the risk even higher. 20 over 10. What does that look like? This is a little bit harder, but numbers that are over one another like that, with that hash mark in the front, and sometimes have the abbreviation millimeters of mercury.
Pressure.
Blood pressure. So 20 over 10, that's no one's blood pressure, but here's what it is. Blood pressure behind smoking is super important about not having a heart attack, because high blood pressure beats up the walls of your arteries and makes plaque more likely to develop. And we now know that we think the best blood pressure to have is below 115 over 75. And for each 20 points on the top or 10 points on the bottom, you add to that 115 over 75, it doubles your heart attack risk. So the numbers that we've all grown up to love about blood pressure are no longer good enough. We want them to be even lower. And I put this slide in to remind you that we even have a new category for blood pressure called prehypertension. Okay? 120 to 139. Oh, wait a second. Was that not normal just 10 years ago? Yeah, it was. So now we have more strict criteria, and it's that prehypertension that I think is super important, because people who have that are going to get regular hypertension if we don't do something differently, like get rid of salt, start exercising, lose 5 pounds. 150. What does that mean? Could mean a few things.
Triglyceride level.
Right, that is right. Triglycerides, a fat in your blood below 150, that's the right number. And I should have been thinking about that, but really what I was thinking about was 150 minutes of aerobic exercise every week is what it takes to have a healthy heart. That's not what it takes if you need to lose weight. That takes more like 300 minutes. But 150 minutes of aerobic exercise, however you care to dole that out, 2 75-minute sessions in the gym going hard, fine. 30 minutes, 5 days a week, okay. Whatever you need, but 150 is the number. Below 100, what number could that be? What is a number that we like to see below 100?
Triglycerides.
Nope, triglycerides under 150.
LDL.
Oh, very nice. LDL is correct, and we're going to look at that a little bit later. Actually, what I was thinking about here was fasting blood sugar. Normal fasting blood sugar, meaning you don't have diabetes and you don't have prediabetes, is below 100. And in contrast, above 125 on that blood sugar is diabetes, which means everything between 100 and 125 is prediabetes. Okay? And having or developing diabetes, it's crazy in our country right now. There's been a 50% increase in type 2 diabetes in the last 10 years, and it's probably related to the obesity epidemic. And as soon as someone develops even prediabetes, the risk of heart disease goes up kind of on a slope. It just goes up incredibly fast. And so one of the secrets of what we're trying to fight is the onset of diabetes, because once people cross that threshold, it's very hard to get that turned around. Oh yeah, this one I hate. Less than 35 if you're a female, or less than 40 if you're a guy.
Waist measurement.
Very nice, you guys are good. And so not only do we have to worry about how much we weigh, but we have to worry about where we gain our weight, which is mostly out of your control because it's really determined by your parents. But women whose waist is above 35, guys above 40, have a significantly higher risk of diabetes and heart disease. 50%. A I'll give you a clue. It's strategic that this 50% is coming right after the
Diabetes.
slide on diabetes. Sorry? Diabetes prevention. Okay, think about this. If people exercise at least 150 minutes a week, and if they have a few extra pounds to lose and they get that done, and I really am talking about a few extra pounds, 5 to 10 pounds can make a difference. That coupled with aerobic exercise can reduce your chance of diabetes by 50%. Better than any drug I got. Pretty cool. 20 years old, what are we all supposed to do when we turn 20 that may not be on our radar? Someone already mentioned it. Get your cholesterol checked. You know, some of the pediatric guidelines are arguing over whether we should check 2-year-olds or not. You know, not sure what we're going to do with 2-year-olds with high cholesterol. But everybody, at least by the age of 20, ought to know your numbers, okay? Get your cholesterol checked, and this bad cholesterol, really, I probably wouldn't have a job if everybody had an LDL cholesterol less than 100. But not everyone needs to have it that low. But your doctor should be able to say how low is low enough for you, because it's determined by other risk factors that you may or may not have. People that already have heart disease, have had a heart attack, we want to get that down under 70. But 20-year-old people that are otherwise healthy, under 190. So there's a lot of variation, and that's a very fair question to ask your physician at your physical. 1987, this is my favorite slide. I was, let's see, was in medical school. What happened in 1987? It's probably the biggest breakthrough in cardiology in the last 30 years.
First open heart.
No, I think that was earlier. No, this was actually the year the first statin drug came on the market. It was called lovastatin, also called Mevacor. This is a list of the statins. You know the names because they're always in the press about people having side effects and how your doctors are trying to kill you by putting you on medications. And then we remind people that in those who need to take statins, they are able to reduce your risk of heart attack or second heart attack or stroke by 30 to 40%. And that sometimes isn't, for whatever reason, very newsworthy, because it's more fun apparently to publish about side effects, which there are side effects that we can generally work around. And so I really want you to not be afraid of statin medication if you need them. And my last number is none, or I should have written 0. I don't know why I wrote none. So how could this be important and pertain to risk factors? The answer is 0. This is my favorite, second favorite one. Well, because it's actually related to symptoms of symptoms of risk factors. Okay, so we talked about diabetes, prediabetes, blood pressure, prehypertension, fasting blood sugar, smoking, and weight. And guess what? None of those makes anybody feel sick. So the answer to this is that you don't have symptoms, even though you may have risk factors. And so the biggest message is to please know your numbers, okay? Know your numbers, and I'm talking about blood pressure, blood cholesterol, waist circumference, blood sugars, all of that. And if they're abnormal, treat your numbers, because in my estimation, heart disease is mostly preventable. If we figure out who's at most risk and what we can do to reduce that, we're not going to have this epidemic that has pretty much been just marching through our country, but you won't know if you don't get them checked. So that's my spiel. So now, could you collect the questions, Sarah, so that we could just zip through, if this prompted anybody to have any ideas. Pretty sure I'm going to trip over this before we do that. All right, bring them up. We can do more too if some people. How important is it to raise your HDL cholesterol? H is for high. You want that. That's a good cholesterol if all your other cholesterol numbers are okay. That's an excellent question. And all of our guidelines target the LDL cholesterol, the bad guy. We want that to be low. And the answer is complicated. And right now, we do not use HDL as what we call a treatment target. We don't give people medicine to bring the HDL up, okay? And so the most important thing to know about HDL cholesterol is a low HDL cholesterol is a risk factor for heart disease. But it's not on the highest list, and it's not something that we treat, okay? But it's something that we want to make sure everything else is okay if you have a low HDL cholesterol. But you should know that there are ways to make that number a little bit better in yourself, which is exercise. Okay, again, that really helps bump up the HDL. And good cholesterol is important because it helps to kind of act as the janitor of your blood vessels to clean everything out. And it's very nice to have a lot of that. You can increase it with exercise. You can increase it a couple of points by quitting smoking, and you can increase it by losing a few pounds. Excellent question. Okay, family history. What about our genetic controls? Do genes affect cholesterol and affect our blockages? That's also a very good question. So when I showed you that earlier slide, having a family history of people who've had heart disease, mostly at a younger age, around the age of 50 or earlier, we think increases your own risk, but there's nothing you can do about that. Okay, you can't get new parents, and you can't change your gene pool. And basically, in people who have a strong family history, they sometimes need to have other tests done to see if there's some other unusual cholesterol disorder that they have that hasn't been tested, because you really look for ways that you can reduce that person's risk. And sometimes, those are patients that I see in my clinic. Say they come in, 30-year-old guy, he's all nervous because everybody in his family has a heart attack at the age of 40. What to do? All his numbers look great. Is a good lifestyle. What else to do? And what I do is check for some other cholesterol-related blood tests that sometimes are markedly elevated that we're just learning about that can be treated, again, with medications if we know early. The other thing to know is that high cholesterol is very often partially inherited. If you've got somebody in your family who has a low HDL cholesterol or who has a high LDL cholesterol, that is very commonly inherited. So yes, our genetics count a lot, but we can overcome the gene pool with great medical therapy. Yeah.
If you have people in your family that have, I don't know, cholesterol or bad heart problems, and you really suspect that something might be going on, is there some way that you can tell the doctor to be sure? You know, sometimes it seems like the doctors, when you have a physical, I know in the instance where somebody had a physical and, 2 weeks later they ended up dying in their living room chair and they were young. Is there some way that you can try to get the doctors to maybe do a few more tests if you can prove that you've got it in your family enough?
A lot of doctors don't know because it's not in their field. I mean, all the studies say treat the risk factors, treat the risk factors, treat the risk factors, and we'll have a better outcome. And that most of the time works. But if, again, there's this family history of early heart disease, especially in people that don't have diabetes, that don't smoke, that don't have all the other traditional risk factors, those are the patients that should come and see me, quite honestly. Because no, most of physicians who are keeping up on every other thing in medicine, which is something new every week, aren't maybe aware about other tests that could be done. Would that have changed this patient's outcome?
Yeah.
Probably not. It's kind of a little too late
so they
sometimes.
have to sort of seek out the people who are in your field.
Yeah, and so that's when a lot of family docs will refer their patients. Is there anything else we should be doing for this patient with a bad family history, like that? Yeah. So what makes the coronary arteries plaque up or block more frequently than other arteries? That's also a very good question, and I probably have misled you. Well, no, I didn't really, because heart disease is definitely more common than other areas of the body that could be blocked. But because we have 6 miles of arteries, why do the heart arteries block? Actually don't know the answer to that question. We don't know. You would think if you had the same risk factors affecting every artery, you'd have blockages elsewhere. Some people do have blockages elsewhere. Some of it is genetic. Some of it is depends on your heritage, because some populations, instead of blocking their heart arteries more often, block their leg arteries and have what's called peripheral arterial disease. We don't understand why we call them vascular beds. Why would the legs be more affected than the heart? We know that people who have leg disease have a much higher risk of heart disease because it's the same disease process, but why it would affect the legs in somebody, other people it affects the brain, and it's called a stroke. If the carotids or the brain arteries are involved with the plaque buildup, you end up with a stroke. We don't know. I don't have a very good answer for that, except that they're all related. We very commonly see our heart patients who also have leg blockages, who are also at increased risk for stroke. The good news is treating the risk factors for heart disease will also help reduce the incidence of those other complications.
So what else?
There's
Another question? Another question?
Is there any way to clean up plaque once it's,
Oh, yes.
once
Yes,
you
I
already
love,
have it, is there any way to clean it up?
yes, there is. First of all, probably statins are the best answer to that question. Statin drugs. Like there's a nice study that I used to tell people about. It's called the Asteroid trial that was done a few years ago in patients that had blockages in their heart. They measured how thick those plaques were and then put half of the patients on Crestor and half of them on nothing and repeated that measurement 18 months down the road and saw that people on Crestor had actually some improvement in how thick the plaque was in the heart artery. So that's pretty cool. Mediterranean diet, okay, we hardly even talked about diet, also can help reduce at least second heart attack in people that already have heart disease. Exercise also helps. It makes the arteries healthier. I forgot to tell you something else about statins. It's super important. People already have plaque, and that is that all plaques have something called a cap over the top. I don't know if you remember that cross-sectional piece I was showing you, but it's got basically a lid on it called a fibrous cap. We like that to be super thick because it keeps the plaque stable and decreases its likelihood to break open and have a heart attack. And statins make that plaque very thick and very sturdy. So we want it to stay in the wall of the vessel, not to open up. So yes, and that's one thing we really try hard with our cardiac rehab patients, to teach them, okay, you have this disease, now what we want to do is get everything right so that you don't have another complication of the disease. And so it's pretty cool. It takes a while to see, plaque regression, but with a very disciplined team of caregivers and a patient, that can happen.
Is there any difference in the type of statin you use? Like you gave the example of Crestor, but there's like a whole laundry list.
There's a whole list of them, and they all have there's very little difference as far as effect, but there are lots of differences among the statins, and some are more potent than others. Some are better taken in people with kidney disease, other little issues like that. Yeah, I always go for the one that's the cheapest that'll get the job done. So we now have we have 4 that are generic, and so those are usually where I start.
Are there side effects to statins?
Well, the best one is living longer. But the most common side effect that people don't like are muscle aches. About 10% of patients, and that's very common, especially in people who are on a lot of other medications or on a very high dose of statins. But that doesn't mean people can't take a statin. It means that maybe that one at that dose isn't working for them. We have a lot of other choices, and that's a lot of my practice, trying to help people figure out what they can take because they need it, that doesn't give them side effects. The FDA makes us monitor liver tests as well, because all statins are processed through the liver. So those are the 2 most common things that we think about. You guys are awesome.
One other question,
Yeah.
and I'm not sure if I understood this statement that I read, but could you tell me how the triglycerides use the HDL?
So triglycerides are a fat in your blood that's actually, it's an interesting one, and it gets better. It works in an inverse relation to the HDL, which is the good cholesterol. So patients that have high triglycerides, sometimes are patients that have prediabetes or are very sensitive to carbohydrates, because carbohydrates and simple sugars raise triglycerides.
Okay.
And when the triglycerides increase, the HDL or the good cholesterol decreases.
Okay.
So once the triglycerides come into check by controlling diabetes, decreasing alcohol, increasing exercise, losing a few pounds, triglycerides come down, HDL comes up.
Okay.
Okay.
Can people ever get off a statin once they're on a statin?
It depends. If anyone has any disease anywhere that we found, okay, as far as atherosclerosis, which is what we're talking about, the answer is it would not be wise, because you lose a lot of that you lose the benefit and it's kind of like stopping your insurance policy. So, yeah.
High LDL and high HDL.
That's a good question.
Do you
Yeah.
need the statin?
Well, that is a good question. The answer is yes. And we used to think, because we used to calculate where we thought people's cholesterol values should be according to this ratio that was between, if you had a lot of HDL, then we could forgive whatever high LDL cholesterol there was. But we've really learned that that's not true. That it's great if you have a lot of HDL. We think there's a ton of research going on in HDL, and some really smart people think HDL above about 90, which is very high, becomes pro-inflammatory and may increase risk. That goes against everything we've ever learned. But we really need to be targeting the LDL regardless of what the HDL is. So I've had a couple women actually come through cardiac rehab post heart attack whose HDLs have been over 100. And really in medical school, which, okay, that was quite a while ago that I was there, pretty much said if you have a high HDL, you can assure your patients they are never going to have heart disease. So there's a lot of research going on, and there are a lot of unanswered questions about HDL. So that's that.
One other comment about the, and I just registered, I guess, the cholesterol, the carbohydrates raising the triglycerides.
It's really interesting. Triglycerides are published on your cholesterol report. Okay. But basically, they are, after you eat simple sugars, even like bread and rice, and people who are very sensitive to those things, that's immediately broken down into glucose that gets pretty much shuttled over to your liver and repackaged into triglycerides.
Okay.
And that happens more commonly in people who may may be more prone to diabetes because in their family.
Okay.
Alcohol also reduces how effectively your liver produces a particular enzyme that's supposed to keep triglyceride levels in check, so sometimes that's a problem. Sometimes the thyroid is out of whack and that increases your triglycerides. But those are really fun to treat because they come down pretty nicely if you can get people on the right track with diet and exercise. Thank you all for coming.
Thank you.
Yeah.